Hi, everyone. I'm Michelle Kondo, and I'm a research social scientist, and I work for the USDA Forest Service. I'm going to talk with you today about some place-based or nature-based strategies for violence prevention in urban areas. So some of you may be wondering, what is the Forest Service doing here, right, in this grand rounds? And I will say that our motto, my agency's motto is caring for the land and serving people in general. So we are about managing and helping to manage and steward our environments and natural resources for current and future generations. And in my work, I focus on urban land and I focus on public health outcomes. So I am located at the Philadelphia Field Station, and we're part of a larger network of urban field stations. So, and our research is focused on urban environments. So we're coming to recognize just how much place matters for our health. So as the saying goes, our zip code is more powerful than our genetic code often in determining our health. And namely, disparities in access to healthy environments is driving some really dire inequalities in our health and exposure to things like violence. I really like this diagram from Ana Diaz-Rue at Drexel now that really talks about some of these broader structural forces, structural racism and segregation by race and socioeconomic status, as well as resource inequalities, drive aspects of both of our neighborhood physical and social environments that affect our stress levels, our behaviors, the way we go throughout our day, which ultimately affect our health. And you are seeing this again. I love this health impact pyramid that just reminds us that it's increasingly we are recognizing that it's important, if we are wanting to make population level structural changes, that it's important to pay attention to and perhaps modify and change if we can the context in which individuals are living and making our just everyday default decisions. I've done some work in thinking about, the state of research on what difference can neighborhood interventions make on reducing violence. And I would say, although this is a tiny bit dated, 2018 now, and we're seeing so much more, that there is a need for a lot more research, right, in this area. What I found is that there really is most consistent evidence comes from housing, and I'm trying not to use this word anymore, blight remediation, but changes to neighborhoods with high levels of vacancy and just historic disinvestment. So changes to both buildings like housing and the land, and some evidence that reducing alcohol availability, improving street connectivity, and providing green housing, so nature, trees, green housing environments can reduce violent crimes. I want to give you just an example from my own research and with my collaborators. I ask in much of my research, can urban, place, and nature-based interventions reduce violence and injury? And this one that I'll share with you is around a vacant lot cleaning and greening intervention done here in Philadelphia. So this is the publication of the main findings, but it was a randomized controlled trial, cluster randomized controlled trial that we published back in 2018, and it was a 5-year study in which we partnered with the Pennsylvania Horticultural Society and their land care program. I'm going to show you some photos of what PHS does with their land care program. But We took about 600 vacant lots and we split. Some of them were control lots and they remained vacant throughout the study. The others were intervention lots that received this treatment. Yeah, so here are some photos. Each vacant lot gets, trash removal and everything is removed from the lot. It gets a standard sort of, grass and a couple of trees planted, and then a permeable picket fence so people can walk through it, but it prevents some of the dumping that we see. So we have short dumping in Philadelphia. So you can see here that the vacant lots, both our intervention and control lots, were very much scattered throughout the city. And we took police reports of crimes, and we compared, compared to after at the control lots compared to, our intervention lots. What changes did we see, if any, in these crimes? And we did find statistically significant reductions in crime overall. As well as, and specifically in gun violence, as well as some property crimes and nuisance crimes in neighborhoods below the poverty line. We also surveyed nearly 450 residents living near both vacant and control lots. And looking at the survey data and thinking about, how or why are we seeing this reduction in violence? We found that people felt less afraid, so they perhaps felt more safe in their neighborhoods, reduced perceptions of crime, of vandalism. They also reported significantly increased use of outdoor space for relaxing and socializing. So perhaps it was, had something to do with sort of more presence and positive social interactions on the street. And we have also calculated return on investment for this type of intervention. If we're looking at the return in terms of cost savings from both firearm and non-firearm violence, ranging from a hospital, and healthcare costs to costs associated with courts and loss of livelihood and impacts, to not just individuals, but families and communities. And we know that typical costs are around $1,600 for each vacant lot initially, and then on just under $200 per year in maintenance. So we calculated that return on investment is $26 in net benefits to taxpayers and over $300 to society at large for every dollar invested in this program. How do we think this works? So I've talked about it a little bit. There are so many theories coming from criminology and sociology. So we have now busy streets theory, which, as I mentioned, this idea that more positive presence and interaction and use in the streets promotes can reduce violence. The broken windows theory, which I would distinguish from the broken windows theory of policing. We're using broken windows here just to indicate that improving environments, even in small ways, can signal to people that environments are cared for and that there is positive. There's attention on space. And it motivates people to perhaps act differently and maybe in more positive ways. And so this is another theory. I like some of them breaking this cycle. I've been part of a group at Johns Hopkins under direction of Kristen Mari and her Project Vital, or Vacant Lot Improvements to Transform Adolescent Lives. We have developed together a greening theory of change, and you can't see any of these words here, but basically, we're saying that both local and macro sort of structural forces are a backdrop for a wider range of greening activities that are going on in neighborhoods in Philadelphia and there in Baltimore, such as gardening, arts, other beautification, just mowing, workforce development, which can improve our dignity, our sense of purpose, our mental health, our relationships with one another, and our environments, and thereby lead to both short and long-term benefits. Violence prevention hopefully being one of them. And so the question is that I and others are trying to, the next step obviously is how can these types of interventions become part of healthcare investments and practice, and it takes it is taking and will take more collaboration, across sectors and within cities and nonprofit groups.